Hey everybody, it's Nina from Sika. I'm our Professional Affiliations and Education Manager, and I'm super excited to have with me James Zervios today. James is the VP and Chief of Staff for the Obesity Action Coalition, so he is a longtime colleague and friend, and he's going to talk to us today about the best week of the year, which is Obesity Care Week, and we are advocating on behalf of our patients this year in DC. So thanks for joining me, James.
Oh, thanks for having me on, Nina.
So tell me about OAC's Obesity Care Week this year and our involvement and what we're going to be fighting for, because I know we've been at this a long time and there's a whole lot going on in this space this year, and I feel a lot more excited and hopeful. I don't know about you.
Yeah, so this year's Obesity Care Week, which will be March 4th through the 8th, is really going to focus on the 5 principles of obesity. And this has been something that the campaign is putting out to really put emphasis on, what is obesity, how are we treating it, so on and so forth. And then throughout the week, we're also going to have a lot of different things that we'll be doing on the first day, the kickoff on March 4th. We're going to be on Capitol Hill, where we'll actually be advocating for the Treat and Reduce Obesity Act.
So I know I'm very well familiar with the Treat and Reduce Obesity Act. I've been part of the team kind of advocating on its behalf is coming up on 10 years, right?
Yep.
So will you give me a kind of a brief overview of that and why all of our healthcare providers should know that as well as we do?
Yeah, absolutely. And for those that are tuning in, you can be a part of this advocacy day by going to obesitycareweek.org and actually contacting your legislator to advocate for the Treat and Reduce Obesity Act. And, this very important legislation, which you pointed out, we've been pushing now for 10 years, really ensures obesity management services for the Medicare population. And I think, you probably would agree, Nina, that the time is different now than it ever has been before when it comes to the obesity treatment landscape, with the options that people have available to them, the options that are approved, but we still struggle with availability and coverage, which is exactly what the legislation looks to fix.
Yes. And I know, as a registered dietitian, this has been important to me for a long time, because part of what, our role in helping treat and reduce obesity involves our intensive behavioral therapy component. And so the Treat and Reduce Obesity Act makes it easier for patients to get the medical nutrition therapy from dietitians when they have excess weight as well.
Yes. Yeah. I mean, there's a lot to the bill. And I think for something that we've advocated, for so long, we've continued to hit roadblock after roadblock. But I do think that things feel a little bit different this year. And I'm very optimistic that hopeful that we're going to see some movement on Capitol Hill. And that's really why Obesity Care Week is so important. And it's so important for anyone watching to help elevate that week and to be a part of it as much as they can.
So yeah, with the new medication options that we have available for treatment, I think it's on everybody's mind, and it is part of the Medicare patient population should have access, just like universal access really should be the case for all of us.
Yeah, and I think it's a misconception that unfortunately the public has, is that we see so many media headlines regarding these new treatments for obesity that there's this assumption that everyone has access or that everybody can afford them. And that's not realistic. And it's very untrue. And we still struggle in a lot of ways with access to obesity management services, especially these new medications. And, the reality is that, yes, the data behind these medications is magnificent, but if no one can access them, really doesn't make a difference at the end of the day for the person dealing with this disease.
Absolutely. And we know, with Medicare, so many other insurances will, pay attention to this type of a decision. And this is really, something I think we've been really at the OAC been advocating for forever. It's just, people who have this chronic disease, just like any other chronic disease, should have access to the treatment options. And even though there is that misconception that, it's going to open the floodgates and everybody who has access is going to take advantage of it. We know that the utilization rates are so low, even when they meet criteria and have coverage. So I don't think people should worry that they're going to, go bankrupt giving a treatment to someone with a disease.
Yeah, really. If you think about it, there's more to the treatment of obesity than just the prescription, if you will, or the option that someone chooses that wrap around approach to care, which you talked about a little bit, in the dietary needs and physical activity and so on and so forth. And then even more than that, I think for the folks tuning in to go to the website and check out what we have around bias as well. I think a lot of people feel like if you go talk to a provider about weight, that it's going to be an easy conversation. And a lot of times providers really exhibit a tremendous amount of weight bias to their patients with obesity. And so we have a lot of very useful tools and resources to help them recognize that and make some changes so you can have a little bit more of a positive conversation.
Totally. And I think that's one of the things that I've loved the most about the OAC is the professional education, whether that be our in-person or virtual conferences or the resources on the website. It really, for healthcare providers, you don't have to start from scratch. You don't have to recreate the wheel. We have so many ways for you to make, these communications or these conversations happen. I've been using the healthcare or weight bias in healthcare providers handout that you guys did a couple of years ago for I don't know, eight years or so, because it's really helpful. It kind of brings the main points to light, and it's helpful for providers to understand their role in weight bias, that it's not just, oh, I don't have that because I don't, say anything overtly. It's really an assessment of your intrinsic or your implicit bias that you have. It's the impact that people have when they internalize weight bias. And there's a lot of that in healthcare. So I think that absolutely, I think all of this is tied together, whether it be, the reason that treatment is not universal has a lot to do with weight bias, I would say.
Yeah, I mean, you hit the nail on the head. And even you talked about implicit bias and intrinsic bias, but also just even the environment that you've created for your patients. I mean, we have so many times people contact us and they say, well, when I go to my doctor's office, I can't find a place to sit. I can't find a chair that I'm comfortable sitting in, or for fear of it collapsing underneath me, or the exam table, the blood pressure cuff. And we point all of this out in that guide that you referenced, the weight bias and healthcare guide. And then you also talked about our resources. That's something that we're not short on at all. OAC has a tremendous amount of educational resources in our resource library, all filterable. And for someone looking for more info on bias in healthcare, we have a ton of stuff in there.
And what I like too about the Obesity Care Weeks in the past, that's been a event for how many years now? 4 or 5 years?
I don't know exactly, but I almost want to say like 8 or 9 potentially.
Okay.
It's definitely been around for a while now.
But what I like about that too is sometimes we know these resources are available, but they're not coming to front of mind. And so what I like about signing up for the event notifications and email kind of reminders is that you guys will do the work to put the right resources in front of us in our email for that week, so we can really sort of connect to what these are and share them on our platforms and with our audiences so that people have access to some of this education. So I'm assuming this year will be the same. We'll be getting resources out around the topics that you mentioned.
Yeah, absolutely. I mean, if you go to obesitycareweek.org and you sign up for the alerts, you're going to get all of those email alerts that are going to bring everything to you in your inbox. But then also on that site, there's a whole resources section where we have a resource section for providers, for patients, and policymakers. So, if you're a healthcare provider and you're looking for more info to help you work with your patients, we have an entire section on that website that you can go to and check it out.
Yeah, that's really great. I think the help around the insurance and the prior authorizations and a lot of that now that I dealt with as a bariatric surgery dietitian and coordinator for years. Now I think a lot of the medicine providers are really starting to say, gosh, there's so much and there's so many components to a comprehensive care program. I think it's not just the medication or the surgical treatment team. It's the dietitian, it's the behavioral health provider, it's the physical activity component. And I would even add that all of these teams should also have someone helping in the insurance communication. I thought that was the hardest part of my job as a bariatric program coordinator because it's not something that people generally understand. They think it's just, send a prior auth and it gets approved. And there's so much that you have to address when it comes to obesity because of some of the biases present in the policy or, just the process, making it hard for people to get treatment options. I think that's a big component.
Oh, yeah. I mean, the amount of hoops that an insurance coordinator has to go through, when they're trying to get approval for something like that, I do think that whole process in and of itself is very complicated, and I think people think it is easy, to your point, and it's not. And we also know that there's a lot of people out there that are denied quite often. And, on our site and even on the OAC's main site at obesityaction.org, we have resources for patients to contact their insurance provider. And how can you advocate? How can you be your own advocate for care? So not only can providers be an advocate for you, but you yourself can advocate for care as well.
Yeah, it's a tough space for both provider and patient. And so I think a lot of times it really does take a provider and a team that's committed to helping patients. And then still, even with a team that's supportive, the patient does often have to do a lot of follow-up, calling the pharmacy, making sure if it's a medication option or following up. And it's a lot. It's a lot to manage. So I think that's why I'm sort of always been a proud OAC member and proud board member, because we do so much in that realm to really help people make some of these complicated things easier.
Yeah, I mean, OAC has, as you know, we have more than 100,000 or 80,000 members, 80,000 members nationwide, shooting for 100,000, by the end of the year. And again, as a longtime board member, you know very well what we are able to offer people and help elevate their story and help them become an advocate for change, which is not always easy. And I think that that's something we've really prided ourselves on throughout the years with the development of our educational programming, such as our annual convention, our brand new program, the YWM regional events, our campaigns, and then, of course, something like Obesity Care Week, which really just keeps driving that awareness.
Ooh, I'm glad you brought up the regional meetings, because that's something I know a lot of my colleagues in this space know about. The OAC's national meeting, the Your Weight Matters convention that's been going on for several years now, and that's always been a really great event, but kind of a one-time yearly event. And now this year, we're trying something new and doing regional events. So I know the first one got kicked off in February in California, and we've got how many others planned? I think, several that I've heard of.
Yeah, so I think there are 5 that are officially planned, but we're looking at maybe adding on an additional 2. We have a variety of cities in there: Austin, Boston, Indianapolis, so on and so forth. And the regional event, for those that have been to our annual convention, we really tried to take the essence of the educational programming and pepper in a little bit of that OAC feel to it and deliver that in a one-day event. As you said, the first one was in San Diego just a couple weeks ago. We had a great turnout for that event. We had more than 110 people registered for the event. So great turnout, and really was able to showcase the educational content that OAC prides itself on, as well as a little bit of that OAC experience. And the feedback we received was excellent so far, with a lot of new people. I have to say that these events, they are very much geared toward bringing new people into the organization. But of course, we welcome all of our members to sign up and go, and they'll learn more about the new obesity treatment options. They're going to learn a little bit about nutrition, a little bit about lifestyle, just a really good overall program.
I think that's also important for the healthcare providers in those areas too. And that's sort of what got me hooked. I came and spoke at your meeting in, I think it was 2016 in DC. And I was hooked ever since, because it's not just for patients. You brought in, some of the best speakers in this space. It was nice to connect with them and have space to, share ideas. And it's really nice for healthcare providers to be on that level with patients, not just that provider-patient relationship that you have in the office. But, to me, almost everything I know about sort of compassionate care and empathy and all of that is really driven by my interactions with fellow OAC board members and people that have come to these meetings, where, they're able to give you an additional in-depth look at how, the real issues, more so than I've even been able to say from clinical practice.
Yeah, and I think, you brought up our national meeting, which unfortunately we're not going to have one this year because we wanted to beta test the regional events. But, rest assured, our national convention will return in 2025. And we're right now in the process of identifying some sites and some hotels. And, that is our much larger event. I think it's I want to say 3-day, 4-day event that we host, and bring in tons of speakers, the best in the field, and then, really invite anyone from all across the country to come and experience that, and also experience the OAC community as well.
That's really great. And so the regional events will be a way, though, for, people to sort of dip their toe in, right? Not
Yes.
commit to even an overnight at a hotel if it's local, which is important because even access to these meetings can be difficult for patients. So
Yeah,
I
there's
know
no
we do have,
charge. So our regional events are totally free. So I mean, you typically they've been Saturdays. The first one is Saturday from about 8 to noon, and you can learn more on our website or even at ywregional.com. And again, there's no charge, and you're signing up for at least a good 3-4 hours of solid education, as well as again a little bit of the OAC feel too.
that's great. Yeah. I know I'm going to push that out to my colleagues whenever it's in their regional area because it's a really good way to get exposure to that.
Yeah,
So
we thank you.
cool. Well, yeah. So I'm looking forward to seeing you in DC and doing the Hill visits on Monday, the 4th, and really getting hopefully a good engagement from our fellow healthcare providers around communication, around advocacy, doing, connecting with their legislators. So is that an ask that we should be promoting? So, advocating on behalf around TROA on that day, or what else can they do now?
Yeah, absolutely. I mean, if they want to do something right now, I would suggest to go to obesitycareweek.org, sign up for the Obesity Care Week alerts, and you're going to get an email on the 4th letting you know exactly what it is you need to do on that day. And, we're going to stay in touch with you throughout the whole week, asking you to do different things and, nothing crazy, nothing too tough, but just to kind of keep you engaged. And it's really going to take a lot of voices to create change. So we need every single person out there that's willing to do something and speak up to take part in Obesity Care Week and help.
Okay. Well, I understand the assignment, and I will do my part to get the word out. And James, thank you. I'll see you in DC on the Hill.
All right. Thank you very much.